Hey, it's Lauren and Alexa. We are the nurse practitioners here at NP2Go that provide some of the weight loss, hormones, and aesthetic services that we do here. Today, we want to touch on a topic that we see pretty commonly, in our day to day. We have patients, women who are perimenopausal or just reaching that menopausal state and battling the hormone aspect, as well as some weight gain and other things like that. So, we wanted to talk about the benefits of pairing the GLP-1 medications, such as semaglutide and tirzepatide, with our hormone therapy. So, that's going to be today's topic, and I'll let Miss Alexa jump in.
So we get the question all the time. Oh, I'm on hormones. Are these GLP-1s okay to still take? And I respond, absolutely. If anything, they're going to work even better because of optimization of hormones. We know our bodies are working at a better rate, better metabolism. Those hormones are helping decrease your risk for heart attack, stroke, high cholesterol. But you think of adding on a GLP-1 to that. Well, we know GLP-1s are cardiovascular safe. They are helping decrease your cholesterol, your overall triglycerides, and blood pressure and heart rate and all the fun things that come along with even weight loss. So really hormones, because they mimic hormones, because these GLP-1s mimic hormones in the way that they work, they really do work synergistically with hormone replacement therapy. People tend to see, wow, my hormone symptoms are getting better. I'm not having the hot flashes or the joint pain. There's a lot of joint pain that comes with decreased levels of estrogen, testosterone throughout the time. And that can actually lead to these chronic aches and pains that a lot of people hear about and you're told, oh, it's normal. You're going to be fine. It's what is expected at your age. And we know if your hormones are optimized, you don't have all of that. Well, the inflammation, the anti-inflammatory effects with the GLP-1s also work in that aspect too. And so, man, you combine both and you're feeling probably better than you were 10 years ago, truly.
Absolutely. I have a lot of women who say, I'm 10 or 20 pounds overweight, and that's something that I've always been able to manage myself. I clean up my diet and I get more active. And well, I've doubled down on that and tripled down and nothing is moving. So there is an insulin resistance component to a lot of women's journeys through menopause. And the GLP-1s are going to be perfect for addressing that. I notice all the time women complaining about the excess belly fat that they didn't ever have before.
Mhm.
They're not used to it. They can't ditch it. They've tried all the things that they know. And that's just, part of the transition season that they're in. And so sometimes the hormone optimization, doesn't address that, as well as the combination of the GLP injection, plus their modality of hormone.
I do think overall too, patients do feel because of the way the GLP-1s work with decreasing visceral fat around the organs, we see that increased belly fat that can be a mix of things, okay? It can be a mix of the white fat that we see that's not necessarily as harmful as some of the brown fat that's that visceral fat around the organs. However, we also know that belly fat is a telltale sign of increased cardiovascular risk. The apple shape, if we've heard of, and I hate that because it's not meaning anything other than you carry your weight in your abdomen. That's what it means versus the lower half or whatever the case may be. And so when you're thinking of that way, well, we know decreased estrogen causes that increased belly fat. Decreased testosterone increases the belly fat and decreases your energy levels. So, man, why don't we add something that's going to help with all of that? And in turn, you're going to see better results because we know where that fat's coming from. And so, man, if we optimize our hormones and we kind of get those in line, plus we add on a GLP-1, man, we are set and ready to go. The only thing I'd like to touch on with the tirzepatide, it can potentially cause a little bit more a potential for hypoglycemia when it comes to like postmenopausal women. It works really well. And postmenopausal women do have a harder time maybe regulating blood sugar like they used to. And so sometimes it can cause more of a hypoglycemic event. So I would just say, hey, maybe eat a little bit more frequently, have smaller, more frequent snacks versus kind of taking the longer times in between meals. And I think that's usually pretty helpful. Otherwise, other than that, yeah, a GLP-1 added on is probably only going to benefit all of that. And in fact, when I see people are on testosterone, estrogen, progesterone, they're like, are we okay to continue? I'm like, yes, please don't stop that. And my gosh, that's going to cause another issue of, okay, here's some more weight gain that we're battling or, side effects and symptoms of the perimenopausal stuff. And as we know, perimenopause can actually we can start seeing perimenopausal symptoms in our 30s. Yeah. Even though you're not going through menopause, you aren't.
Some of the symptoms still
there.
And I wanted to
Decades.
touch on like a long-term game plan. I get the question a lot, do I have to stay on both of these forever? Potentially can ditch the GLP when you're at your goal weight and have done a long maintenance phase. Hormones you're going to want to keep on board. Some people, depending on their lifestyle habits, can ditch that GLP or cycle on and cycle back off, and you're going to get the same level of benefits and protection since that's kind of how you got to your goal.
But I will say that really doesn't go hand in hand with hormones. Like Lauren said, the hormones are something that really do need to be consistent and something to stay on. And I think people have a hard time understanding that. But truly, the best benefits of hormones are only really seen after 5 years of continuous use of the decreased risk of dementia, the decreased risk of cardiovascular events. All of that kind of hits after you've been on them for a while. So super important to realize it can't just be like a quick fix thing. Unfortunately, as we age, we have learned and exposure to all the things in the world, bodies are naturally decreasing with age. So there's no way your body's going to continue or to all of a sudden start producing these hormones out of nowhere if you aren't getting them somehow else. So something just really important to remember, GLP-1 is great for cycling on and off or maintenance phase, but hormones really do need to be utilized very consistently.
Yeah, because we're not trying to just eliminate the hormonal symptoms. We're also trying to ensure that those organs are protective and preventatively, moving forward with age.